Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Different so precocious puberty. First we have different defects in puberty. One, there can be either precocious puberty or there can be delayed puberty. In precocious puberty occurs in females. If the puberty occurs in females less than 8 years of age, that is precocious puberty. That means if the breast budding occurs less than 8 years of age, then it is precocious puberty. In males, if puberty occurs less than 9 years of age, that is, if testicular enlargement occurs less than 9 years of age, then it is precocious puberty. Most common cause of precocious puberty is idiopathic. Precocious puberty is more common in girls than in boys. It is due to the estrogen excess. And the drug of choice for precocious puberty is continuous gonadotropin releasing hormone. Precocious menstruation is also seen. Precocious menstruation occurs when is said to have occurred when the menarche occurs less than 10 years of age, then it is precocious menstruation.
thank you and thank you for watching.